What's up, it's Destiny back again for another video, and this is going to be an update on radiation. Before I get into this video, make sure that you are subscribed to the channel so that you don't miss an upload, and be prepared to leave a comment and a like so that I know that you like this video and, you know, push us out in the algorithm. I'm gonna say this. Today was day 14 of radiation. Radiation, if you're not familiar, is every weekday, every Monday through Friday. I go at 10:30 every day, and I'm tired of it, and I want to stop. I'm actually going to talk with my oncologist on Thursday to see if we could see any progress, because I'm basically at the halfway point, because I don't want to continue. I'll get into the reasons why I don't want to continue after I share any changes that I've experienced. So the only thing that I'm really feeling is obviously fatigue. Any kind of treatment, any type of anything is going to begin to drain you. And the past couple of days I've really been starting to feel it. Today I really feel it. Also, my arms are sore, both of them, because the position that I have to be in for radiation, since we are radiating the right side of my body, my breast and underarm area, I have to be like this for 20 minutes at least. That's treatment, 20 minutes. Now, I can be in that position much longer. I have been in that position much longer when they're doing scans or they're trying to make sure that everything is lined up properly, getting their numbers, this, that, and third. Okay. So right in this area, it's starting, even on this left side, it's starting to become sore. It's starting to become uncomfortable for me. I have met with 2 physical therapists, and they have both showed me exercises to do, which I've been doing them. I do them throughout my day. I do dedicate time outside of well, I'm just sitting doing like this, you know, to really stretch and do yoga and things like that. And but it's still that soreness. Every now and then, randomly, I will get a pain in my breast area or in my arm, and I figure that's just like from surgery and all of the things that's going on. Nerve pain as well has happened, but that has gone away. What else have I experienced? Not too much of discoloration. You can't see because how ironic, I'm wearing a low-key fake turtleneck today, so you can't even see the chest area, but the discoloration isn't really happening. I do see where this side is a little bit more, you could, I don't really turn red, but a little more red than this side. I was looking in the mirror the other day and I was like, okay, so this is maybe the sunburn people were talking about. I can kind of feel it. A few days ago I was feeling tenderness in my breast. I don't really feel that today. I have noticed that the tiny bit of armpit hair that would be here isn't there. I don't know if that's because of radiation. So yeah, that's really all that I've experienced and noticed thus far. Like I said, I've been using obviously the shea butter, the coconut oil, the aloe vera gel, and the Aquaphor. I rotate. Like in the mornings, I'm using shea butter because that's what I use on my body already. After treatment, I use aloe, and then before I go to bed, I use Aquaphor. I do that even on the days that I don't have treatment, which is on the weekend. I'm still moisturizing my skin, and especially those areas, because I don't want no peeling, no blisters, none of that stuff that they say could possibly happen. So I'm doing everything to prevent that. I met with the doctor yesterday, which was Monday, and we went over some things. As far as like how I'm feeling, he did let me know that I could take a week break if I wanted to give my skin some time to like regenerate or whatever. I went into this saying I'm not doing that. I just want to go straight through and get it over with. I don't want to take breaks if I don't have to. If it's not going to harm me in any way, I don't want to have to take a break, you know. But I'm getting to the point where I just want to stop completely. And it's not so much the actual physical radiation. I mean, it is irritating. I have to stop my workday to go down there, change clothes, sit there for 20 to 40 minutes, depending on what's going on that day, come back. You know, that is a disruptor of my life, but I can deal with that. I can tolerate that. When radiation is happening, you don't feel, I don't feel laser beams attacking me or anything like that. I don't feel any heat, so that's not an issue. What the issue is the care team, the care that I'm receiving from the people. I talk about this a lot on my Instagram, but I'm bringing it here because I let y'all know everything, especially involving my health, since I brought this to YouTube. So I'm not gonna not share. The doctor, Dr. Factor, amazing doctor. He listens to me. He's in action. If I say something, he's already putting a prescription in. He's already making a phone call before I could get back home. Like, he's very proactive. He's very on top of it. He cares about his patients, and I love that. I can say Dr. Lay loves her patients. She loved me. If she don't love nobody else, she loved me. Dr. Wilkie loves me. You know, they're care teams. Except that one incident that I had with this nurse that was working for Dr. Lay, but she was mean to everybody, and they had to let her go. And you're not nice. So outside of her, everyone in Dr. Lay's care team, amazing. All those nurses, amazing. I feel safe with them. Dr. Wilkie, her staff, her team, those other doctors that perform surgery on me, amazing. I felt safe. I trust them. Dr. Factor, I love him. He's amazing. Them people in the room where I gotta be up like this, not so much. I name dropped before. Wendy, Jameson, Natalia, cool. The rest of the people, no. So last week there was an instance where, well, and I would tell you the front desk, and I told Dr. Lay, something's in my eye. The front desk staff don't speak to me. I would come in, good morning, no response. Like, they're so busy at work that they can't even say hello. So like, okay, you know, I would come in to every appointment, even my oncology, big attitude, not attitude, but big personality, happy, joy, bubbly, because I'm always the youngest one there. So I want to spread that joy and that hope to other people. Okay, that's why I wear my Crocs. I love my Crocs and they're comfortable, but I know that they are a conversation starter because of the decorations that I have on them. Everybody is like, oh my God, your Crocs are so cute. Makes people smile. You know, we're going through enough. Why not be nice? Why not try to go out of your way to make somebody's day? You know, to acknowledge somebody. So that would be happening. And I talked to Dr. Lay about this, and she's like, you need to say something. And I did. So I also with the team here is a lot of different techs. I thought they were nurses. They're not. They're techs or whatever. And a few of them are male. This is my first time dealing with male doctors, male nurses, male people touching me. Okay, that I'm not inviting to touch me. You get what I'm saying? So this is different for me. When you're on the radiation table, you are topless. You do have a gown and you do have a blanket, but you have to take your arms out of that gown and you have the blanket over you. I have tattoos. I have a tattoo here. I could show y'all. It has nothing to do with the nipples. It has nothing to do with the left breast. It's right here. I have tattoos on the side at the bottom of my rib cage. I showed y'all that before. Has nothing to do with the breast being exposed. There was a time last week where I was on the table, arms up. You know, I'm thinking we're doing our regular procedure. They just snatch it down. Men are coming in and out. Not only are men coming in and out of the room, there's cameras up top that are watching you. Those cameras go to the monitor that's outside the room where the techs are, where anyone's walking by. Patients are walking by. Other men are walking by. So they snatched it down. My titties are exposed for the world to see. Why are we doing this? You haven't been doing this before. That has nothing to do with anything. I was so uncomfortable. I cried on that table while I was getting the treatment. Okay. So I think it was the following day I complained on my Instagram, and people encouraged me to make a complaint because they have a survey box. So I wrote down my complaint about how these men techs are coming in and they just start touching me. They're not introducing themselves. I don't know who they are. The people at the front are not friendly at all. They don't speak to me when I'm coming in or when I'm leaving. So I put that in the box. That was last week. So I let some days go by. Nothing happened. So one of the techs, that's a man that just went in touching me and all this sort. I said, hey, what's your name? What's your name? And he told me, oh, my name is da-da-da. Okay. And I thought that was a very indirect, maybe it was passive aggressive, but I thought that was a way of saying like, hey, yeah, I didn't introduce myself to this girl and I'm just touching her with my cold, pasty hands. You know, I thought that would have been like a ding, ding, ding moment. No. So fast forward until yesterday when I'm arms up in the air. It's a lady who I don't know. Never seen her before. Don't know her name. Nothing. Jameson is there. And then there's a tech. I can't remember. Or was it two? It was in and out. Coming in, out, one stayed. You know, because it's usually 3 in the room at one time. And so arms up. I'm just like, whatever. Regular day, regular appointment. Jameson knows what to do. So I know he's not going to expose me to the world because he hasn't before. Shorty over here, she comes over. And she's touching me while she's saying this. And she's talking as if I'm not there, as if I'm not conscious, okay? Does she have stickers? Does she have tattoos? Where is it? Are they uppers? Are they lowers? And then she just snatches the blanket down. Exposure to the world for everyone to see unnecessarily. My initial reaction was to right hook. I'm telling you. But my brain kicked in and was like, girl, so I just snatched the blanket up. I said, I have lower tattoos. And she's like, okay. And she's just doing it. And she still was trying to pull down the left side. And I kept my arm up here. There's nothing on the left side. There's nothing for you to look there. And so after that happened, I just sat there very quietly. Because I was like, this is insane. So I go through with the treatment. Oh, and they don't help me up off the table. So you're laying on your back, arms up like this. In the beginning, Wendy, Jameson, and Natalia would help me off the table. They don't help me off the table no more. So I'm struggling, and they're just standing there. I'm struggling to get off the table, to get to a sitting position. Okay? So once I'm able to do that, then I told Jameson, I said, hey, I didn't appreciate that right there, how she just snatched the blanket off me and exposed me to everything. I said, that hasn't happened before. Well, it has happened before, but it's unnecessary. It's not what is needed. She didn't even know what she was doing. I don't feel comfortable. I'm letting you know because I talked to you, but I'm gonna be letting you know that I'm letting Dr. Factor know as well because I don't feel comfortable at all. I really don't. And he was shocked and he was like, okay, I'm sorry about that. Da-da-da. Okay. So I went, and as I'm leaving, the girl's gonna say, you're gonna see the doctor too. I said, yep, and kept walking. And I expressed these concerns to Dr. Factor. I told him I don't feel comfortable. I don't feel safe because how are you about to treat a patient? You don't know anything. You don't even know clearly what side that's being treated. You don't know where the markers are. How are you going to make sure that I'm in frame for the radiation if you don't even know where to look? It takes 2 seconds to look at my file to say, oh, she has lower tattoos, treating the right side. That takes 2 seconds. And then to be talking as if I'm not even there. I told the doctor, I said, I felt like a science experiment on show for just whoever to come in and look and touch and do all this and that. I said, I don't feel comfortable. I don't feel safe. They don't introduce themselves. They're exposing me when they don't have to expose me. I don't know what's going on. And honestly, I don't know where it shifted. I had a very good experience in the beginning. And this is like the last leg of treatment, low key. Besides the immunotherapy. But this is like the last leg of treatment. You go through chemo, you go through surgery, you go through radiation. Everybody should be happy and cheery for us because, baby, we made it through cancer. This is the last little bit that we have to do. But this is my experience. I'm to the point I want to stop. I don't want to go back. I don't want to feel like a science experiment. I don't want to feel like I'm just another number on your chart. No, I don't like this. So, I don't know. I might call up there today and say, hey, Dr. Factor said I could take a couple days off. I want to take a couple days off. I might do that. But then that's just going to push it down. And I don't want to push the process down, but I can't deal with this. I'm walking in there feeling defeated because these people are rude. They're not greeting me back. Hey, good morning. You don't hear nothing back. It's like, okay. Then you get in there and you got strange school shooting that's how they look. You know, and I don't know if it's a race thing because nobody in this office looks like me. In my oncologist office, mixed. You have all types of people working there. From black, white, Asian, Spanish, or Hispanic, Latina, whatever. Y'all know, I don't know all the things. Even a lady, I don't know if she's from Poland or something. All kinds of people are working in that office. Everyone is friendly because they understand what you're dealing with. My surgeon, mixed crowd of people working there. Everybody is friendly because they know what you're dealing with. These people here, they all the same. And they're not friendly. And they know what you're dealing with. So, I don't know. And I just feel very beat down and very defeated because it's like, I'm getting this on all fronts in my life right now. The damn lady across the street, people in my life, like just everywhere. And I'm tired. I am tired. Like I feel as bad as I felt when I was going through chemo and when I wanted to give up. That's how I feel now. This is radiation. I shouldn't feel this bad. And it's not because of side effects from the treatment. It's because of the people that's giving me the treatment. I don't trust them. I don't feel comfortable. I don't feel safe. I don't know what to do. I've made a written complaint and I made a verbal complaint. And I'm still feeling like this today after those things. After I was told, well, we have a meeting, so I'm going to address these things at the meeting. And I'm still feeling like this. I don't know what to do. I really don't. I'm going to think about it a little bit more. And like I said, I might take the rest of the week off. Or tomorrow at least. I don't know. I really don't know what to do. But, yeah, I just feel real defeated. I need a break. I don't know. But I can't take a break. I'm a single mom. I got to keep going. I can't stop. You know, I got to work. Who's going to pay these bills? So, I don't know. But something got to give. Because I cannot feel like this. Because if I continue to feel like this, I'm going to get stuck here. And then it will be like it was with chemo. And I'm going to want to just give up on everything. And like someone said, oh, well, you've come too far to stop now. Yeah, I have. I've come too far and I've dealt with too much that I shouldn't have had to deal with too. And I'm an advocate for myself. And it's still not, you know, so I don't know. I didn't mean to get emotional. I didn't mean to get loud or whatever. You know, I'm not apologizing. This is how I feel. This is my experience. This shit is real. This is my life. But that's the update. Day 14 out of 30 of radiation. There's your update. Okay. I guess I'll let y'all know what happens from beyond this. I don't know what's going to happen. I really don't. But whatever you do, try to always do your best, especially when you're interacting with people. I try my best not to let my mood interfere with somebody else's day. You know, I really try my best. But everyone's not like me, and everyone doesn't have that mindset. Everyone doesn't have compassion. or empathy. But just try to be kind to the people around you. And if you can't be kind to them, just, I don't know, stay away from them. I don't know what to say. But, you know, subscribe to the channel. Give the video a thumbs up. In the comment section, I don't know, what's your favorite color? I don't, put whatever in the comment section. If you love someone, tell them. I love you all.